Hello, and we're back. This is Dr. Gerard Cuomo. I'm here with Larry's case. It is a Branemark rescue case where we've had a problem occurred coming in from another office where the two screws, the abutment screws, have separated. We were successful at removing them from the mouth, and we covered that in detail in our previous video. This one now has a small little finish to it. Now what we're going to do is, while we're waiting for the parts to come in, and we did order them from Implant direct, as I stated before, they purchased a company called Attachments International, and I've got it. And we worked steadily with a gentleman by the name of Darwin, who's the technician there, and he's directed us perfectly here in this case. So now we're going to put these little healing abutments that we have had sterilized and kept in our own supply. So now Larry will have those to wear during his waiting period, which was coming up. Today is Monday. We'll be back at it on Thursday to finish. So stay tuned for that. Now we're going to go to the mouth where we have applied a cleaning tartar and stain cleaning solution. And I'm just going to tip Larry back a little bit further, put him into focal length. We're using a dental microscope for this procedure, and our patient is avoiding some really costly and really unnecessary surgery to replace these implants. So as we've done in many cases in the past, we were able to successfully salvage the case and order new parts to replace the old ones. So now I have proxy brushes I'm going to use. Now that we've had some of this material might come up again, it's probably still on the threads, and we do want to be meticulous about this case all the way to the finish. It's kind of like removing cement from your, can you see all that? Now look at how much has actually come up even further. So we still have our cleaning job to do here, getting these threads meticulously clean. You know, for all you car enthusiasts, think of it as spark plugs. You know, you got a good clean thread on a spark plug, you can be able to replace that without a problem. Now, of course, today I don't think we have many of that technology unless you got an older car. Again, you can see how much is actually coming up. So we're going to be rinsing with a smaller suction, actually using a smaller suction. And I'm using a cavity cleanser. It's basically a very mild soap, so we'll use a little bit of that to flush out. Just turn a little bit toward me. Great. Now let me back that up. Retract the lip. And we're just flowing some cavity cleanser in there. And just being careful. And then we're going to go back down now, and I'm going to just rinse my my instruments off. And I have them over here. I have them in a little container. And we kind of hang on to containers in this office. You never know when you're going to need something that serves a purpose. So these are old containers where the articulating paper came from. We just use those as a little bath. And you can see all the particles coming off on that. Just kind of using the smaller. There's two sizes to, I want to say, to the proxy brushes. So we went with a smaller diameter size. That worked out pretty well. But you can see how that tip is starting to get pretty black and building up with material, BioBird material. So we're going to see what else we can stir up in there. Maybe a few more particles will come up. And then we'll do a visual inspection at the end of this screws themselves, screw threads. So if I get it in there, I like to twirl it. And I like to do it in a counterclockwise. I would keep everything counterclockwise. You don't want to stir things down, you want to stir it out. So go counterclockwise and then out. Then take a look. And you can see, just put it in your finger and you see what comes out. You see there's still some more in there. So again, you clean the brush, go back in. I'll get around. I'll go to the one in the back. And you should try to get these two closed. See, if you leave them open without any kind of a cap on them or something to prevent the inevitable. Again, you're going to get more and more product. So if you zoom in, you can actually see the black particles come up out of there. And again, we've got them back on this again. So we're going to need another one of these. So I'm going to summons Maria, if you can get me one more, give me 2 more of the green color code proxy brushes from Hygiene. I don't know, do we keep them chair side or do we? Okay. Okay. See, all that's coming out. That's been dried in there, caked in there. We got to clean that all out. Okay. This is a brand new one. Thanks, Maria. I'm going to get that out. That looks good. Just to loosen things up. And we'll do the same thing next time he comes in next week. So now, again, just can I have the microsuction tip, please? Okay, and retract gently the lip here. Okay. Look how efficient that micro tip really does work. All I'm trying to do is just get stuff flushed out of there. What I'll do is I'll video the armamentarium and then alright. Well, Larry, I'm going to take a visual look and everything looks good in there. I'll give you your little healing caps and then we'll be done for the day. So I need to look straight down in there with my mirror. Oh, golly, that looks great. Definitely got to do a little more cleaning next time, but I'll be happy to take that. Most of everything is clean now. And so what I'm going to do is just very, very so gently just tighten these little healing abutments now. It's got a little tissue tag on this anterior abutment. I'm going to move that out of the way. And we may end up probably pinching some of the tissue in there. And so I'm going to add a little topical anesthetic. I'm going to add a little bit of topical so Larry doesn't feel it. So Larry, I'm just going to numb the gum a little bit with a topical. You can borrow her. She's fine. Yep. No problem. We're good. We'll yell if we need anybody. Okay. And micro brush or micro suction to get any excess of this next. So I'll do a micro suction now. Okay. Doing great. He's got a little tissue tag right there. I'm not too worried about it at this point, as we're going to deal with all the new parts next time he comes in. Alright, I'm going to take the first abutment, and then I need the next abutment. I got that over here. I'm just going to double check. That looks good. Dry everything off. Oh, good. You okay, Larry? So just literally just slowly hand tightening, because now it's just going to come down on the tissue that's in the way, right? You okay still? Yeah. Is it pinch a little bit? You feel it a little? Okay. Not really. Okay, I didn't tighten that one all the way down yet because I want to put the other one in. And just make sure we're good to go on these. Yep. All right. Okay, again, Larry, just turn toward me a little bit. Okay. There we go. You okay? Yep. Alright. That you feel. Okay. Alright, so what we need to do now, we're on tissue, so we're going to back it off. We're going to take our periodontal probe, and we're going to just, maybe even just this Blunt and Explorer, just bring the tissue out. The tissue's underneath it. And I'm going to spend a little time with that, but basically what he's doing, he's going to go home with these two temporary abutments. Just turn a little bit to your right. Yeah, these two temporary abutments. And that's it. From here, this is I guess you can call it the first part of the rescue case. And we'll come back on Thursday, give you the rest of it. And that's it. Take care. Thanks for watching.